You are listening to the Pregnancy Podcast with Vanessa Merton. Hello, thank you for tuning into the Pregnancy Podcast. You can see the full article and all of the resources and links that accompany this episode at pregnancypodcast.com/troubleshooting. Thank you to Mommy Steps for their support of this episode. You can save 20% off the Mommy Steps insoles with the promo code FEET, and that also works for Form insoles. Mommy Steps insoles are combining a comfortable cradle for your foot with optimal arch support. That's because changes during pregnancy, like weight gain and increased levels of relaxin, can create lifelong changes to the structure of your feet. So keeping your feet properly supported when you're pregnant can help alleviate some of these common pregnancy-related foot problems. One of those is that pregnancy can cause the arches of your feet to flatten out. This can lead to all kinds of problems. Stress and inflammation in the tissue that runs along the bottom of your feet, called your plantar fascia. That inflammation can morph into plantar fasciitis, which is extremely painful. And over time, that overpronation can lead to increased strain on your feet, your legs, and your back. The good news is that wearing insoles can help preserve your arch and properly support your feet during pregnancy. Mommy Steps makes insoles for athletic footwear. They also have insoles designed for flats, boots, or casual shoes. And you can even heat mold these in your oven to customize them to your feet. This only takes a few minutes. It makes a huge difference. And you can do this up to 3 times. So you're going to have custom insoles for every trimester. Please be proactive about protecting your arch and the structure of your feet. Do not wait until you're having problems. To check out the Mommy Steps insoles, go to pregnancypodcast.com/feet and use the promo code FEET to save 20%. Thank you to Boppy for their support of this episode. You can save 20% off Boppy with the promo code PREGPOD20. Boppy makes support pillows that are going to make breastfeeding or bottle feeding your baby so much easier. The Boppy Original Feeding and Infant Support Pillow ergonomically supports you while you're nursing or bottle feeding. It's versatile to grow and support your baby during supervised awake time through all the milestones in the first year. Feeding from birth, propping them up at 3 months, tummy time at 6 months, and sitting at 9 months. I had this pillow for both of my babies, and it was something we used every single day. It's small enough to fit in a rocking chair while nursing or bottle feeding, but large enough to give you the lift that you and your baby need. You can put it around the front of you or on your side, on your waist, so you can get the best support for your feeding style. Boppy makes its products with high-quality materials designed for easy care and cleaning. The pillow and the cover are both machine washable. This is designed for your baby's supervised awake time only. This product is not for sleep. To check out the Boppy Original Feeding and Infant Support Pillow and other products that I love from Boppy, go to pregnancypodcast.com/Boppy and use the promo code PREGPOD20 to save 20%. Thank you to Blue Blocks for their support of this episode. You can save 15% off Blue Blocks blue light blocking glasses with the promo code PREGNANCY. Your exposure to blue light can significantly impact your fertility, your pregnancy, and your overall health. And there's so many things you can do to reduce the amount of blue light that you're exposed to after sunset. The easiest way to block out 100% of the blue light is to wear blue light blocking glasses. The reason that I love Blue Blocks is they block out a specific spectrum between 400 to 550 nanometers. This is the range you need to block after sunset for better sleep. Your sleep and your circadian rhythms drive your hormones, and blue light exposure can affect hormones like estrogen, progesterone, and prolactin. These are so critical for fertility and pregnancy. Simply wearing these glasses for a few hours before bed will block out the blue light that negatively affects your health, and it will improve your sleep. You can save 15% off Blue Block's glasses with the promo code PREGNANCY. To check them out, go to pregnancypodcast.com/glasses. In this episode, we're talking about troubleshooting issues that can come up when you're breastfeeding. I really wish breastfeeding was natural and perfect from the start for everyone, but the reality is that it might take some work. Realistically, it will probably take some work, but it's 100% worth it. But you need to give yourself and your baby some patience and some understanding that it may take time and patience to get this all figured out. So in today's episode, I really want to talk about tackling some breastfeeding issues. But this is not going to be a substitute for the value that you can get from seeing a lactation consultant or going to a breastfeeding support group. I really cannot emphasize enough how helpful it can be to get help as soon as you need it, because those small issues will become bigger issues later. I know the thought of hiring a consultant may sound expensive. Many times you can find these resources for free. La Leche League is an excellent starting place for this. Also, check with the venue where you are planning to give birth or where you gave birth, or check with your midwife if you're doing a home birth. Ask them for resources. I have a page on the Pregnancy Podcast website at /breastfeeding where you can see all of the articles, episodes, and all of the resources in one spot. Also, the Kelly Mom blog is such a fantastic resource for breastfeeding related topics. Throughout this episode, if you see the article on my website, I link to a lot of their articles because they take something that I'm just talking about for 2 minutes and they'll have a very in-depth article on it. And The Womanly Art of Breastfeeding is an amazing book with everything you could possibly need to know about breastfeeding all in one place. This is a book I've read multiple times and referred to over and over while I was breastfeeding. So with breastfeeding, this is a relationship between you and your baby. And if it's going to work, it has to work for both of you. There are so many issues that can come up. Some problems are going to show up in you, others will present in your baby. I want to give you a baseline understanding of these issues. That way, if you run into any of these, you're going to think, oh, I know exactly what this is. I know where to go to find more resources on how to treat it, rather than having something come up and just thinking, well, this is not fun and I'm not enjoying breastfeeding because I'm having this problem, and not having any resources to treat it or places to go to get help. So hopefully we'll tackle that in this episode. The first I want to talk about is leaking. This is very common in the beginning when you're getting everything calibrated with your supply and your baby's demand. If your breasts are full and you do not remove milk, they will leak. It's also possible that they're going to leak at very random times, like when you hear a baby cry at the grocery store. If you're concerned at all about leaking, then you want to use some nursing pads. Disposable pads are convenient to use and trash, especially if you leak and you need to swap them out when you're away from home. You may also want to consider washable nursing pads. Those you just throw in the washer and dryer and just wash them with your laundry. One downside I've had with reusable pads is that if they get wet, it tends to feel wet against your skin, whereas disposable pads tend to absorb more moisture and wick it away from your skin. If you want to try reusable pads, I'll link to my favorite ones in the show notes for this episode. Another issue you may run into is that your baby is latched, but it's painful. This is likely due to them not being latched properly. And there's a trick to get your baby off your nipple painlessly so that you can help them latch properly. So to do this, you're going to take your finger and put it in the corner of their mouth in between their gums and twist your finger. That's going to break the suction, and that gives you an opportunity to start again. And if you're doing this over and over, it could frustrate your baby. It might also frustrate you, but in the long run, that's going to save your nipples. Also, when you're getting your baby to latch, you might want to try tilting your nipple before it goes into your baby's mouth. So aim your nipple towards their upper lip and then wait to put it into their mouth until their mouth is open wide. You can also squeeze your breast to compress it and make it a little bit easier for your baby to fit it in their mouth. This might be a little bit awkward at first, but with time and practice, You and your baby will find what works best for you. Another issue that can happen is sore nipples. When you're starting out with breastfeeding, this is a part of your body that isn't used to this much stimulation all the time. But most often, sore nipples are related to a poor latch. So like anything, you want to fix or correct the underlying problem. You don't just want to treat the symptoms. So if your nipples are sore, don't just keep putting some kind of ointment on them and not change how your baby's latching or how they're positioned. You really want to treat the underlying problem. And as you're fixing that, obviously you want to give yourself some relief if you have damage to your nipple. One thing that you can do is to start your baby off on the other side. Their sucking tends to be more intense at the start of breastfeeding. Put them on the nipple that's not sore. After breastfeeding, you can use a saline solution on your nipple, just 8 ounces of warm water and 1/2 teaspoon of salt. You're going to soak your nipple for about a minute. You don't want to overdo it. Don't do it too long. And then pat your nipple dry and put some breast milk on your nipple. Remember, your breast milk has anti-inflammatory and antibacterial properties that can help promote healing. You can also use nipple cream that's going to give you some relief and may speed up healing. Nipple cream is not something that you should be using every day for your entire breastfeeding life. That's something that should be short term to help in healing while the problem that caused the damage is getting fixed. And then when you're not breastfeeding, try and give your nipples exposure to air. You can use mild soap once a day on your nipples if they're chapped or cracked. Damaged nipples are very uncomfortable, but they will heal and get better. And the more proactive you are in correcting latching issues as soon as possible, the more you can prevent problems like cracked nipples. Many people think that the solution for cracked or damaged nipples are nipple shields. These are made from clear silicone and they're worn over your nipple during breastfeeding. These can also be used for a baby who's having a tough time latching. There are some disadvantages to using a breast shield, and these are commonly misused. So before you use a nipple shield, I highly recommend that you see a lactation consultant. Often these are more of a short-term solution to some issues that there might be a better solution for. So that's why I want you to go see a lactation consultant. I've also had friends that have tried a nipple shield and then found that they could never breastfeed without it for the entire length of time that they were breastfeeding. And I'll link to an article that talks about some of the challenges of using a shield, including that it can be very tough to get your baby off of it. Another issue you may run into is that pumping is painful. There's a couple things you can do for this. You can try lowering the suction on your pump. If it's too high and you're uncomfortable, it's not going to work well because it's going to hurt and it's not going to be effective in removing milk. You may also want to try a different sized flange. The flange is the part that goes on your nipple. If it's too small, it's going to be uncomfortable. A sign that the flange you're using is too small is if your nipple is swollen or darker after pumping. Now, it's normal for your nipple to be slightly bigger after pumping, but it should not be swollen. Your nipple should also easily move in and out of the flange. You can try some olive oil to lubricate it and see if that helps. And I know that it's easy to kind of separate pumping and breastfeeding as two separate things, but these are so related. And a lactation consultant or a La Leche League member can help you if you're having issues with pumping. If you need help with pumping, bottle feeding, supplementing, anything related to breastfeeding and feeding your baby, try a lactation consultant or a support group. Don't assume that those are only for breastfeeding. I actually saw a lactation consultant when we were having trouble getting my son to accept a bottle, and she was a tremendous help for us. You probably didn't know that your nipple can actually have muscle spasms. This can cause the blood to flow out of the nipple. And when that happens, it feels like a stinging or burning sensation. During that spasm, your nipple is going to turn white, and then it's going to turn red when the blood flows back in. Usually this happens after a feeding. It can happen in between feedings. To stop a spasm, in the middle of it when it's happening, you can squeeze the base of your nipple. Some breastfeeding women find that keeping their nipples warm can help with that, and that cold sometimes triggers it. This isn't something that happens to everyone, but if you are dealing with vasospasms or nipple blanching, I'll link to an article with more information. It's common to have a bleb or a milk blister, and this is a tiny white spot on your nipple, and it kind of looks like there is milk stuck in a pore. If this is not painful, you really don't need to do anything about it. But if it's bothering you, you might want to try soaking a cotton ball in vinegar and wearing it over your nipple in your bra. Milk has calcium in it, so vinegar can help dissolve that. You could also try soaking in the bathtub or a shower, or soak a cotton ball in water or olive oil and put that over your nipple in your bra. You could also try soaking your nipple in a cup of warm water with 2 teaspoons of Epsom salt before you're nursing your baby. Like I said, most of the time, these are not painful, and if it's not bothering you, you don't need to do anything about it. It will likely work itself out. Probably one of the most dreaded issues with breastfeeding is that you're not making enough milk, that you have an undersupply. This is one of the top reasons that mothers start supplementing with formula or that they stop breastfeeding. And remember, milk works on a supply and demand system. So the more milk that you remove from your breast, the more milk your body will make. The number one thing that you can do to increase your milk supply is to increase how often you're feeding your baby or how often you're pumping. Now, pumping is a great way to provide milk for your baby or to store it for future use, but a pump is not going to remove milk as effectively as your baby can. Also, before you jump to the conclusion that you're not making enough milk, make sure that that's the case. Again, please seek the help of a lactation consultant if you have concerns about not making enough milk and you want to continue to breastfeed. If your supply has decreased due to some underlying issue, you want to fix that issue. You don't just want to keep pumping more milk throughout the day and try and power through it. I'm going to link to some additional resources on increasing low milk supply, but if you think that this is a problem for you, please do see a lactation consultant. You may also be considering lactogenic foods or galactagogues, and these are substances that are thought to increase milk supply. Lots of moms have lactation cookies or smoothies that usually incorporate these types of ingredients. You should know that eating foods or consuming herbs that theoretically increase supply are not going to make up for nursing frequently. That is for sure step one when you're trying to increase supply. One study surveyed women who use some type of galactagogue, and overall they found it to be helpful in increasing their supply. In this study, it wasn't scientifically measured. It was through questions in a questionnaire. So it's possible that there was some placebo effect there, meaning they perceived an increase in milk supply just because they were consuming something that they thought would increase their supply. Some common ingredients that you'll see in lactation cookie recipes are oats, brewer's yeast, flaxseed, coconut oil, almond butter, or even dates. These ingredients may be beneficial overall by providing things like vitamins, minerals, irons, healthy fats, but there really isn't a lot of evidence to support their efficacy in increasing supply. The most common galactagogue that you're going to see recommended is probably fenugreek. If you're interested in reading more on fenugreek and seeing the evidence available on that, I'm going to link to an article from Kelly Mom. Also, the group Moby, Mothers Overcoming Breastfeeding Issues, has a really good article that breaks down lactogenic foods and herbs, and I'll link to that as well. On the opposite end of the spectrum from not making enough milk is having an oversupply. Now, I know at first this may seem like a good problem to have, but it can create a lot of other issues that can make breastfeeding really difficult. Oversupply may mean that you have a forceful letdown. This is when your milk comes out too quickly and your baby has a tough time nursing because of it. It's like them trying to connect to a fire hose. Oversupply can also contribute to more serious problems like engorgement, plug ducts, and mastitis. A lot of moms who experience oversupply will notice a decrease by around 3 months. And it's tricky to use methods to reduce supply without overdoing it, because you don't want to just reduce your supply and then create a problem where you're not making enough milk. And I'll link to a couple different articles with more information on that. Oversupply is another issue that a lactation consultant can be invaluable for, especially if you're considering taking some kind of herb or supplement or doing something to decrease supply. I mentioned that oversupply can lead to engorgement. You're likely going to experience engorgement when your milk first comes in. This can also happen if you go longer than usual in between feedings. When your breasts are engorged, they are going to feel really full. They're going to be heavy. They're going to be tender. They might be hard. They can even feel warm or hot. When you're engorged, it can make it difficult for your baby to latch. The top tip to help with engorgement is to nurse your baby. If you're engorged, you have to remove some milk from your breast. If it's hard for your baby to latch, you can try putting pressure around your areola with your fingertips to try and press some of that fluid back. Just so that way the area around your nipple is softer. It's going to be easier for your baby to latch onto. And this is called reverse pressure softening. To get a better idea of how to do this, because honestly, pictures are probably going to help you here, I'm going to link to a Kelly Mom article on reverse pressure softening that has pictures that are going to make this concept much easier to understand than me explaining it over a podcast. If you're engorged, you can also express a small amount of milk by hand or with a pump. Remember, because of that demand and supply system, if you're engorged and you empty your breast completely, you're basically telling your body that you need that amount of milk at that time, and then you're likely to get engorged again. A warm shower can also make it easier to hand express some milk. That heat probably won't help with engorgement, but it does seem to help when expressing milk. If you're engorged and your breasts feel hot and uncomfortable, cooler temperatures may be more helpful in dealing with that discomfort. So in your breast, you have a lot of ducts that send milk to your nipple. When one of those ducts gets plugged, it's not getting emptied, and it can get hard, swollen, red, or feel warm or hot to the touch. It's almost as if that duct is engorged, right? Same symptoms. This is usually due to ineffective removal of milk. If your baby isn't eating well and you're getting engorged. This could also be caused by a bra that's too tight or that doesn't fit well. It's really important that you're wearing comfortable bras and tops that are not digging into your skin. The best thing to do to treat a plugged duct is to empty the milk from your breast. You also want to make sure that you're drinking plenty of fluids and that you're eating well. And if you have a plugged duct, before you breastfeed, you can apply some heat to your breast with a warm compress or take a warm shower, try to massage it. And while you're nursing, you want to massage from that plugged duct towards your nipple just to try and help it get unclogged. If a plugged duct is not resolved, it can turn into mastitis. This has the same symptoms, but they're often more intense, and it can be accompanied by a fever and flu-like symptoms like aches and chills. So while mastitis is basically a more severe plugged duct, it may or may not be an infection. If it's an infection, it could be caused from bacteria that enters through a point of damage on your nipple, like if you have a cracked nipple. And to treat mastitis, typically you want to follow the same treatment as for a plugged duct, but you also want to rest, preferably in bed with your baby. If there is an infection, antibiotics may be used. If you're running a fever and have flu-like symptoms, please contact your doctor or midwife to talk to them about their suggested course of action and whether or not you should consider antibiotics. Plugged ducts and mastitis are very similar. There's a really great article on the Kelly Mom site I'll link to that compares and explains the two. One of the risk factors for mastitis is weakened immunity. I got mastitis with my son. It was not fun. When I had my daughter, I got mastitis and made one mistake after another, was trying to avoid antibiotics. It turned into a huge ordeal. The mastitis and the plugged duct turned into an abscess. I ended up in the hospital. It was not a fun experience. I did an episode on lessons learned breastfeeding the second time around where I talk about that and walk through all the mistakes that I made, and then talked about some of the things that I actually did right when I started treating it like I should have been from the beginning. If you want to listen to that episode, I'll link to it. It is so critical to take really good care of your health when you're breastfeeding, especially in those first few weeks when mastitis is most common. So if there's anything that's your go-to to strengthen your immune system, this is the time to do it. My go-to for this is athletic greens and lots of rest. That is my personal formula for boosting my immune system. With breastfeeding is going to come spit up. That's what you're stocking up on those burp cloths for. Usually, this really doesn't bother your baby much. It's gonna look like more than it is. If you feed your baby and they spit up, don't think that they just spit up everything that they just drank. This is common. It's really not a reason to be stressed out. If you think that your baby is spitting up more than they should be, you can always bring it up with a lactation consultant or your pediatrician. Also, spitting up is very different from vomiting. Spitting up looks like milk free-flowing from your baby's mouth. Vomiting is a forceful ejection of the contents of their stomach. Luckily, there are some very simple things that you can do to reduce spitting up. One is to burp your baby after eating or even burp them mid-feeding. You can also keep them upright for a little bit after they eat, rather than just laying them down right away. In the early days, you may run into a problem where your baby is falling asleep at your breast. In those early newborn days, it's really important to get breastfeeding well established. And that can be hard if you have a baby who's falling asleep or who's just overly sleepy. It may be recommended to wake them up to nurse every 2 to 3 hours during the day or every 4 hours at night. That's usually just until they get back to their birth weight. Check with your doctor, your midwife, or your pediatrician for their suggestion on how often you need to be feeding your baby in those early days. The most common suggestions to gently wake a sleeping baby or to keep them interested in nursing is to gently burp your baby, change their diaper. Any activity that is gentle, like undressing them or holding them in a different position, may wake them up a little bit and get them more interested in breastfeeding. And I'm also going to link to an article that's got a lot more information that can be helpful if you're dealing with this. At some point, you may experience a nursing strike. And this happens when your baby suddenly decides that they do not want to breastfeed. Key word here being suddenly. This is not your child weaning. It is very rare that a child would wean on their own before age 2. A nursing strike can be for any reason. It could be something simple to detect, like if your baby has a cold and their nose is stuffed up and it's really hard for them to eat. Or it could be something really obscure, like you ate something different and there was a slight change in the taste of your milk, which obviously you wouldn't know about. Fortunately, there are some tips for dealing with a nursing strike. First, you still want to express milk because you want to keep up your supply and you want to avoid plugged ducts. If your baby's not breastfeeding, you can express milk by hand or with a pump. You cannot force breastfeeding. It just doesn't work that way. Your baby may be more amenable to nursing at night or when they're sleepy. You might want to try breastfeeding in a different position or in a different place. If you are going through this, it can be extremely stressful. And I'll link to another article aptly titled "Help, My Baby Won't Nurse" that's got a lot of good ideas to help deal with this. On the opposite end of a nursing strike is a baby who will not stop breastfeeding. And this can be very frustrating at times, but it is normal. Your baby is not going to eat in the same patterns every day. And this is going to vary a lot, especially early on. So cluster feeding is when your baby spaces feedings closer together during a part of the day. For example, maybe every day from 5 to 8 p.m., your baby just wants to be attached to your boob. You take them off and they freak out on you. It is common for babies to be naturally fussier in the evening, and they may prefer to be at your breast and nursing during that time. That is their safe, comforting place. And remember, this is normal. So if you have a baby who's getting fussy in the evenings and they're cluster feeding, I'm going to link to some more information on that topic for you. A big contributor to cluster feedings is your baby going through growth spurts. And you're going to know when they're doing this because they're going to be breastfeeding a lot more often. They may be more fussy than normal. When your baby does increase the amount that they're feeding, it will be temporary. It usually just goes for about 2 to 3 days. It could be as long as a week. Some common time frames for growth spurts are 2 to 3 weeks, at 4 weeks, and at 3, 4, 6, and 9 months. Of course, every baby's different, but these seem to be the most typical. While growth spurts can be challenging times with a baby, it is pretty awesome that your baby and your body can adjust the amount of milk that they need during and after a growth spurt. Some babies will experience food allergies and sensitivities. Everything that you're eating is getting passed to your baby in trace amounts in your milk. So if your baby has an allergy or a food sensitivity, there's a lot of symptoms that can pop up. This can be your baby being more fussy than normal, spitting up more often, having more gas than usual, sometimes a rash that shows up on their cheeks or even their bottom. You may even see some signs of eczema. The only real way to tell if something that you're eating is bothering your baby is to cut it out of your diet and then see if the symptoms improve. Some of the foods that are most often associated with allergies and intolerances are cow's milk, which isn't just in milk, but is also found in cheeses, butter, and a lot of packaged foods. Also soy, eggs, wheat, and corn. And if you do eliminate something from your diet, it could take a week or two to fully see symptoms improve, assuming that it was that food that was causing the problem. That can be a very challenging process of trial and error. And if you think your baby has an allergy or a sensitivity, please bring it up with your pediatrician. Just a couple more of the more challenging situations that can come up with breastfeeding. One is tongue tie. And this is when your baby's frenum or frenulum, this is the membrane under their tongue, is too short and it restricts the movement of their tongue. So when your baby nurses, they stick their tongue out. And if they can't do that, it's going to make it hard for them to get a good latch and to effectively remove milk. Some symptoms of tongue tie are that your baby has difficulty maintaining a latch or they're not able to suck or swallow effectively. Now, if your baby does have a tongue tie, you may be able to see it, but you're going to need to have it diagnosed by your pediatrician or a lactation consultant. To treat a tongue tie, a doctor is going to snip the membrane. That's done with a local anesthetic. It's a very quick procedure. If your baby does have tongue tie, the sooner you get it fixed, the better. And if you have any questions or concerns about a tongue tie, please bring it up with the lactation consultant or your pediatrician. Another issue that can come up is a yeast infection and thrush. These present symptoms both in you and your baby. So a yeast infection on your breast is going to make your nipples pink and shiny looking, your skin may be flaking, and you're going to have burning, itching, or pain. It's very uncomfortable. If your baby has a yeast infection in their mouth, then it's known as thrush. The problem is that this gets passed back and forth between you and your baby. A sign that you would see in your baby is if they have creamy white patches in their mouth and on their tongue that do not wipe off. It's very common for babies to have kind of a little bit of a white coating on their tongue from drinking milk all the time. This should wipe off easily. If you think that you and your baby might have thrush, you want to seek out a lactation consultant or your doctor or midwife, your pediatrician. There's quite a bit of things that you need to do to treat thrush effectively. That's going to involve you, your baby, and anything that's coming into contact with your breasts or your baby's mouth. So please talk to your pediatrician if you think you may have thrush. And lastly, I want to touch on jaundice. This is caused by a buildup of a chemical called bilirubin in your baby's blood. This is formed naturally from the body's normal breakdown of red blood cells, and the liver is responsible for removing it from your bloodstream. But often, a newborn's liver doesn't work quite as efficiently as it needs to, and the result can be a slight yellow tinge to their skin. It's common for babies to have a mild case of jaundice, which is completely harmless. But if bilirubin reaches high levels, it can become a serious condition if it's not treated, and it can lead to some very serious health problems. Jaundice does tend to be more common in newborns who are breastfeeding, and most often in those who are not nursing well. So if you're breastfeeding, you should be nursing your baby 8 to 12 times per day in those first few days. That's going to help produce enough milk and help keep those bilirubin levels low. If you suspect that your baby has jaundice, please talk to your pediatrician. You want to keep breastfeeding. You want to do it often. That's one of the best things you can do to prevent this issue. If your baby does get jaundice, it's going to first appear on their face, and then on their chest and abdomen, and finally on their arms and legs. It can even show up in the whites of their eyes. But again, this is something you want to catch early and take care of early. When you're meeting with your pediatrician, especially in that first checkup, that's one of the things that they're going to look for. And if they suspect that it's present, they may have a skin or blood test to diagnose it. Jaundice does tend to peak at about 3 to 5 days old. That's the time frame when bilirubin levels are highest. And if your pediatrician determines that your baby does have jaundice and it needs to be treated, there are several ways it can be treated. Bilirubin levels can be reduced by placing your baby under special lights when they're undressed. And that's something that could be done in the hospital or even at home. And I'll link to an article with a lot more information on jaundice. I know I've mentioned it a dozen times at least in this episode. I cannot overstate the importance of getting help from a professional for any breastfeeding issues. An international board-certified lactation consultant can make a world of difference. And it's awesome that you are listening to podcasts or reading articles, but none of this will be a substitute for a professional who can help to resolve an issue. I really encourage you to reach out to a lactation consultant if you need assistance or if breastfeeding is not going smoothly. And if you're concerned about the cost or have limited resources, please reach out to your doctor, midwife, your pediatrician. Also, start with La Leche League. This is an international organization that has so many free resources and support groups. To recap today's episode, we talked about troubleshooting so many issues that can come up in your breastfeeding journey. Now, I sincerely hope that breastfeeding comes naturally and runs perfectly smooth for you from the very start. But the good news is that if you do run into any of these issues, you're going to be able to identify it and have an idea of some ways that you can treat it or where to go for more information. Thank you for tuning into the Pregnancy Podcast today. I hope that you find this episode helpful. As always, you can contact me, Vanessa, at pregnancypodcast.com, and you can read the full article and see all of the resources and links that accompany this episode at pregnancypodcast.com/troubleshooting. Thank you to Mommy Steps for their support of this episode. Mommy Steps insoles can help preserve your arch and properly support your feet during pregnancy. To check out the insoles, go to pregnancypodcast.com/feet. Use the promo code FEET to save 20%. Thank you to Boppy for their support of this episode. Boppy makes support pillows that make breastfeeding or bottle feeding your baby so much easier. As a reminder, Boppy products are for babies' supervised awake time. They are not for sleep. To check out the products I love from Boppy, go to pregnancypodcast.com/Boppy and use the promo code PREGPOD20 to save 20%. Thank you to Blue Blocks for their support of this episode. You can save 15% off blue light blocking glasses with the promo code pregnancy. Blue light can affect estrogen, progesterone, and prolactin, all critical hormones for fertility and during pregnancy. And the easiest way to block out the specific spectrum of light that negatively impacts you after sunset is to wear blue light blocking glasses. To check out Blue Blocks, go to pregnancypodcast.com/glasses and save 15% with the code pregnancy.